Measuring knee extension and flexion. Patient will be in a supine position. The first thing we'll be doing is measuring the extension. Have a towel placed underneath the ankle to make sure full range of motion of extension is possible. Place the axis of the goniometer on the lateral epicondyle, the movement arm lined up with the lateral malleolus, and the stationary arm lined up with the greater trochanter. Here we are looking at a plus 5 degrees of hyperextension at this joint. To perform knee flexion, you will remove the towel. Ask the patient to bring their ankle to their bottom as close as possible. And it'll look something like this once again. Same measuring spots as earlier. And here we're looking at 140 degrees of knee flexion.